Hello everyone, welcome to my micro teaching chapter. I picked a topic for this week of the respiratory system. It's called mycoplasma pneumonia, 支原体肺炎. You might already hear this word from the news recently, which this kind of infection is definitely circulating in the community and hospitals right now at the beginning of this winter. So let's get started. And mycoplasma pneumonia bacteria commonly cause mild infections of the respiratory system. Sometimes these bacteria can cause more serious lung infections that require people stay in hospital. And good hygiene is important that help decrease the spread of mycoplasma pneumonia and other respiratory germs. And first of all, what are mycoplasma pneumonia infections? So mycoplasma pneumonia are bacteria that can cause illnesses by damaging the lining of throat, lungs, bronchus, and just all the liners of the respiratory system. People can have the bacteria in their nose or throat at one time or another without being ill. And when someone infected with mycoplasma pneumonia, they coughs or sneezes, they create small respiratory droplets that contain the bacteria. And other people that can get infected if they breathe in those droplets. However, most people who spend a short amount of time with someone who is sick with mycoplasma pneumonia, they do not get infected. Actually, the bacteria often spread between people who live together since they spread a lot of time together, a longer time. These pneumonia outbreaks occur mostly in crowded settings like schools, daycares, long-term care facilities, and hospitals. During school-based outbreaks, if people in the community get sick, they are usually family members of ill school children. And moving on, what are the signs and symptoms? In general, infections caused by mycoplasma pneumonia are very mild. So symptoms depend on the type of infection. The most common type of infection is called tracheal bronchitis. The tracheal or trachea, which means the large windpipe of our lungs, and bronchus is the smaller or end stage of the windpipe, and itis, which means inflammation, so trachea bronchitis, and also it can be simply understood as chest cold. And common symptoms of a chest cold include the sore throat, feeling tired, having fever, slowly or worsening cough that can last for weeks or months, which is very annoying, and headache. Children under and younger or under 5 years old who get mycoplasma pneumonia infection could have symptoms that are different from adults or older children. Instead, they may have the following cold-like symptoms like sneezing, stuffy or runny nose, sore throat, watery eyes, wheezing, or even vomiting or diarrhea. And so how do we prevent this kind of pneumonia? People can get infected with mycoplasma pneumonia more than once. So while there's no vaccine to prevent mycoplasma pneumonia infections, there are things people can do to protect themselves and others, which is simply practicing good hand hygiene. Like many respiratory germs, mycoplasma pneumonia most commonly spread by coughing and sneezing. So if we practice good coughing etiquette, like cover your mouth and nose with tissue when you cough or sneeze, and wash your hands often with soap and water for at least 10 to even 20 seconds. Or if the water, if clean water is not available, use the alcohol-based hand rub thoroughly which can kill the germs on the skin. And I think people all very care about how to treat this kind of infection while people are get infected. So mycoplasma pneumonia infections are generally mild, which means people can stay home and use the over-the-counter medication, but some people may need to stay in hospital for more treatments. If you want over-the-counter medications, maybe ask a doctor or a pharmacist. They can help you. And on the other side, people stays in hospital. They developed pneumonia, the very serious lung infection caused by mycoplasma pneumoniae. Doctors usually prescribe antibiotics. There are several types of antibiotics available to treat pneumonia caused by this kind of bacteria. The antibiotics can help patients recover from the infection faster if they started early on. Some pneumoniae are resistant to some antibiotics used for treatment, which is not a very very good news. But which means the doctor, when prescribe those kind of antibiotics, they need to be very careful. So speaking of those names of these antibiotics, there are macrolide, tetracycline, or the third one, which is called fluoroquinolone. So clinicians should not prescribe tetracycline and fluoroquinolone for young children, and because they are toxic. And microlines are generally considered the treatments of choice. So, however, like I just said, clinicians should be very careful when prescribe those kind of drugs, and if they use those drugs wave after wave, years after years, and eventually it will create a resistance strains of mycoplasma pneumoniae. 好，下面我来用普通话来讲解一下我今天这个课程。我选了这个话题呢，叫支原体肺炎，是由这个肺炎支原体细菌引起的。这种肺炎支原体细菌呢，通常会引起这个呼吸系统的轻度感染。这个时候呢，这些细菌会导致有的时候这个细菌会导致更严重的肺部感染，需要人们就住院治疗了。而且良好的卫生习惯呢，对于减少这个肺炎支原体感染和其他呼吸道传播的病菌是非常重要的。首先我们了解一下什么是肺炎支原体感染。肺炎支原体它是一种细菌，可以通过破坏喉咙、肺还有支气管的内壁而导致疾病。人们的鼻子啊或者喉咙里，就是上呼吸道可能会出现细菌，但不一定会生病。但是当感染肺炎支原体的人咳嗽或者打喷嚏的时候，会产生含有细菌的这个小飞沫，就是 droplets。其他人如果碰巧吸入这些飞沫，就有可能会被感染，但是不一定，因为大多数人与肺炎支原体感染的患者短暂的接触是不会被感染的，或者说他不会发病。也就是说，如果和这个肺炎支原体达到一定的浓度，或者接触感染的时间比较长，比如上学呀、住院呀，长期在一起有几天的时间，感染的几率就会大大增加。所以说这种肺炎呢，通常发生在人群比较聚集的地方，有规律的在一起的地方，比如说学校啊、日托中心啊、长期护理的机构啊、老人院呀，或者是医院等等一些比较拥挤的场所。在学校呢，爆发疫情的期间，如果社区中有人生病，他们通常就是学校的小孩子啊，或者是幼儿园的小孩子啊这样的。接下来让我们了解一下呢，就是有哪些迹象和症状。一般来讲呢，肺炎支原体的感染症状比较轻的，它的症状取决于感染的部位和类型。最常见的感染类型呢，就是支原体的引起的气管炎，也就是咱们常说的胸部感冒。 这个胸部感冒的症状呢，经常包括主要就是咽喉痛和咳嗽，或者是发烧。这个咳嗽呢，可以逐渐变得很厉害，也就是说，一开始可能1-2声干咳，但是通过这个时间的推移，感染天数的增加，那么它这个咳嗽可能会逐渐的恶化，白天咳，晚上咳，可以持续几周或者是1-2个月都有可能。再有其他就是一些感冒的症状，比如说感觉很累啊、发烧啊、头痛啊这些的。但是支原体肺炎很奇怪的一点是，5岁以下的儿童感染支原体肺炎，或者是小的儿童，它可能出现与这个大龄儿童或者是成年人症状不相同的一些症状。他们可能会更多出现类似感冒的症状，比如打喷嚏呀、呼吸道这个流鼻涕呀、鼻塞呀、咽喉痛啊，还有就是眼睛流泪，这个喉咙里面发出这个哮鸣的声音，或者甚至是呕吐或者是腹泻。那么我们如何预防这种肺炎呢？人们感染肺炎支原体可以是很多次的，它并不是说感染一次终生就免疫了，它没有疫苗可以来预防这种肺炎支原体的感染。但是人们呢，可以采取一些很简单的措施来保护自己和家人。其实就是通过保证良好的这个呼吸道或者手的这个卫生。它和很多呼吸道细菌一样哈，这个肺炎支原体呢是通过咳嗽啊、打喷嚏啊传播的。这个良好的这个咳嗽礼仪、咳嗽的这个处理方法，比如像咳嗽的时候、打喷嚏的时候啊，咳到手肘里啊，用这个纸巾遮住口鼻呀，经常用肥皂水、流动水洗手至少20秒。如果没有水龙头的水干净水的话呢，随身携带一些这个含有酒精的消毒液，也是非常去涂抹这个皮肤上的细菌，也能把细菌杀死杀灭，来阻断这个细菌的传播。支原体肺炎呢，通常感染是比较轻的，但是有些人可能需要住院来治疗。大多数人呢是无需使用抗生素来治疗的。像您的医生呢，或者是药剂师来询问一下，用一些这个非处方的药物，在家休息就可以缓解。但是有的人如果出现了肺炎感染的症状，需要用抗生素的话，就是以下几种。一类呢叫大环内酯类抗生素，它就英文名叫它的那个叫典型的药物就是咱们可能听说过阿奇霉素，是属于红霉素类的，它叫 azithromycin。还有一类就是四环素类的，四环素它 tetracycline，它代表的药物叫多西环素或者是米诺环素。多西环素是 doxycycline，米诺环素的英文是 minocycline，它的这个后缀都是什么什么 cycline。然后最后一类就是咱们所说的现在比较新、比较贵的一种叫氟喹诺酮类药物，叫 fluoroquinolone，fluoroquinone 这种类型的药物，它比较典型的就是环丙沙星 ciprofloxacin 和莫西沙星叫 moxifloxacin。正常情况下，医生呢是不能随便，最好是不要随便给患者滥用这些抗生素药物，因为支原体的变异性非常强，而且一定要注意呢，临床医生是不应该给婴幼儿或者是妊娠的妇女开四环素类或者是氟喹诺酮类的药物，也就是莫西沙星类的药物，因为大环内酯类的药物呢，像阿奇霉素，通常来讲是比较安全一点的。但是就是由于近几年肺炎支原体耐药的情况非常严重，所以还是要提醒临床医生呢，或者是大家不要依赖这个消炎药太多，尽量是采用一些物理疗法或者是对症治疗的疗法，慢慢休息的话，大部分人都能够很快痊愈的。